Welcome back to the Athletes First Performance podcast. Today, we're talking about the 5 benefits of working as a physical therapist for the Army's H2F program. What is H2F? H2F stands for Holistic Health and Fitness and is the Army's embedded human performance program. It consists of 5 domains or 5 pillars, which are physical, nutrition, sleep, mental, and spiritual. Today, we are focusing on the physical pillar in regards to physical therapy. So, what are the 5 benefits? First is direct access to care. So, physical therapists working in the Army have the luxury of direct access to care, meaning that we don't require a referral from a physician to start a plan of care. This improves the access to care for MSK injuries and allows soldiers to see a physical therapist as soon as possible after an injury. The current model that we work in allows for same-day care, with the longest wait period being 1 to 2 days from initial injury. And as physical therapists, we know that the sooner we can get a soldier or a patient in to see us, the better the outcomes. That way, they get a better understanding of their actual injury. They can start the process to getting back to return to duty, and they don't have to rely on Dr. Google. With direct access to care, physical therapists are viewed as primary care providers for MSK injuries. So, being a primary care provider comes with increased responsibility, as we are typically the first medical provider to see a soldier or a patient after their injury. So, we need to understand red flag screening and proper triaging to make sure the patient is appropriate for physical therapy. With this comes the ability to order imaging. So, we need to understand what imaging is appropriate in regards to x-rays, which views we need to order, and indications for advanced imaging, such as MRI, arthrogram, or bone scan. Number 3 is no insurance limitations. So, as a physical therapist working in the Army, we're not limited by insurance companies on the number of visits that we're allowed. We don't have to justify for billing, and we're able to work with soldiers as long as we need, as long as it's medically justified. So this allows us to practice top-notch care and provide what is needed for the soldiers to get to return to duty without jumping through the loops of insurance and having to provide unjustified treatment or extra treatment just to get increased billing codes. Number 4 is working a part of a human performance team. So, like in the name, we can provide holistic care for injured soldiers. And as physical therapists and human performance professionals, we understand that injury is just not MSK factor. Oftentimes, there's other things in place, such as nutrition, sleep, fear avoidance, and other mental factors that we have the ability to work together as a team to get the soldier back to duty. And last thing is coaching, teaching, and education. The human performance teams are made up of anywhere between 20 to 25 members that are responsible for anywhere from 1,500 to 4,000 soldiers. So it's almost impossible to provide solely one-on-one education or care. And there's a big emphasis on educating soldiers to be force multipliers within the brigade and teaching larger groups over one-to-one care. Some examples of what we do in terms of group education or treatment include reconditioning programs. So the ability to work as a hybrid physical therapist and strength coach for larger groups of injured soldiers to make sure that they're able to maintain physical fitness and rehab in the presence of injury. There's also education opportunities for training medics to improve MSK triage and initial treatments, teaching large groups of soldiers recovery techniques, principles of strength conditioning, as well as teaching proper running mechanics and running technique to prevent further running related injuries. So this is just our initial post and to get some people thinking and bring awareness to physical therapists within the Army and the military as a whole. If you have any questions, comments, concerns, you can follow us on Instagram at Athletes First Physio. The link will be in the show notes, and there will be more episodes to come regarding Army healthcare, physical therapy, performance, and so on.